So in this session, we'll deal with the histology of gallbladder. Gallbladder is a pear-shaped mucomuscular sac that concentrates and temporarily stores the bile. Capacity is around 30 to 50 ml. It is situated in the fossa for gallbladder on the inferior surface of liver or the visceral surface of liver. It receives bile from liver through a cystic duct. Gallbladder has following three layers: mucosa, fibromuscular coat, serosa, and adventitia. So if you see, it is different from. So if you see, it is different from intestine in the way that intestine will have mucosa, submucosa, and muscularis externa, and it will have serosa or adventitia. But in case of gallbladder, if you observe, there is mucosa, but there is no submucosa, and muscularis externa is modified into fibromuscular coat, and there is serosa and adventitia. Even if you see the mucosa, there will be lining epithelium and lamina propria, and there will not be any kind of muscularis mucosa, and there is complete absence of submucosa. So fibromuscular cord, it will have smooth muscles and running in different directions separated by collagen fibers. So you have to remember that there is no submucosa and muscularis mucosa in gallbladder. And even if you observe, the mucosa will have folds which are temporary, but it will not have villi. So interior of the gallbladder shows numerous mucosal folds. Numerous mucosal folds. It is not muscular folds. It is numerous mucosal folds. Numerous mucosal folds. So simple columnar epithelium with basally placed ovoid nucleus and faint eosinophilic cytoplasm shows numerous apical microvilli to increase the surface area for absorption. So shows apical striated border. Some authors also consider it as brush border due to presence of microvilli. So it is simple columnar epithelium with basally placed ovoid nucleus and faint eosinophilic cytoplasm. There are no goblet cells. There are no villi. Okay. Lamina propria, there is no muscularis mucosa and submucosa in the wall of the gallbladder. Lamina propria is present. The fibromuscular coat, smooth muscle cells with interspaced collagen and elastic fibers are present. Smooth muscle cells are not organized like the classical gut pattern where there will be inner circular and outer longitudinal bundles. So here they will be running haphazardly. And here you can see there will be Rokitansky Ashcroft sinuses. They look like glands, but they are just extensions of the mucosa into the fibromuscular coat. And there will be serosa or adventitia. So if you observe, the inferior surface of the gallbladder will be covered with peritoneum. So we call it as serosa, and the superior surface, which is in relation to the liver, it is covered by the adventitia, which has dense connective tissue, blood vessels, lymphatics, and autonomic nerves and elastic fibers. So you can see here, these are the mucosal folds. These are the mucosal folds, and here you can see the extensions of the mucosal folds into the fibromuscular coat, Rokitansky Ashcroft sinuses. So here you can see this is the lamina propria, and here you can see this is the fibromuscular coat where you can see this group of smooth muscles separated by collagen and elastic fibers. So lamina propria of the gallbladder is not having any kind of lymphatics. So here you can see the serosa or adventitia. So this is the slide how it appears. These are the mucosal folds. This is the lamina propria and the fibromuscular coat. This is serosa. So mucosa, simple columnar cells with striated border. Lamina propria will have connective tissue, no lymphatics. Fibromuscular coat, bundles of smooth muscle fibers with interspaced collagen and elastic fibers. Serosa or adventitia other than inferior surface. Gallbladder is covered by connective tissue adventitia. So cholecystitis, it's the inflammation of the gallbladder, and cholelithiasis is the formation of gallstones. Thank you.